Okay. Hi, Nicole. How are you?
Hi. Good. How are you?
Good, good. Thanks for being here virtually and being
Sure.
willing to talk about your career in dental. And I
Yeah.
know your official title is Extended Function Dental Assistant. Did I get that right?
Yes, that
Okay,
is
wonderful. So I don't know a lot about what that specific title means. Can you
correct.
walk us through what your job looks like in an average day?
Okay. So, and just to kind of go back for a second, my official title is somewhat new in California, but I, I started off as a registered dental assistant, which most people are more familiar with. So, the average day, whether a registered dental assistant or what I am now, extended functions dental assistant, it, it's being my dentist's right hand person essentially. So, but what goes into that is planning ahead, um, always being two steps ahead of my dentist,
Mhm.
making sure I'm totally prepared for whatever procedure that we're doing throughout the day. So I'm always looking ahead of my schedule, whether it be the day before or just an hour before, to make sure that I have my setup correct with my instruments and all of the materials that I need. So it's a lot of you're you're thinking about what you're doing at that moment while you're assisting the doctor with the patient, but
Mhm.
you're also thinking, okay, this is how much time. I'm looking at the clock saying, okay, this is how much time till our next patient is here, and this is what I'm going to need. So
Mhm.
it's just a constant, you're thinking ahead. You're
Yeah.
thinking and you're planning, and you have to be prepared for anything and everything really when it comes to your procedure. So, and our procedures consist in our office, we're a general office, is fillings, crown preparations, emergencies. We don't do cleanings, but we have registered dental hygienists that do cleanings in the office. But my focus and my dentist's focus is primarily on the health of the teeth, where the hygienist focus is the gums and the bone.
Mhm.
So that is what I'm focusing on all day long.
So you
But yeah,
mentioned a lot of organization.
yes.
Have you always been a kind of an organized mind, or did you have to learn how to do that?
No, I've definitely been that way. And when I got into it, didn't really realize that that would apply, but it worked out really well.
Right, right.
I
So
mean,
yeah, that's really helpful. So we all are familiar with, I think, teeth cleanings and fillings, unfortunately for some. So yours, you are assisting the dentist as they're doing procedures. Is that right?
yes,
Okay, so you're like right in there in someone's mouth and dealing with like, the body. Can you
yes.
talk a little bit about what that's like and what tools you use?
So yeah, I guess just naturally, I don't get grossed out easily. I know a lot of people do when they think of bodily things in the mouth. Yeah, there's gonna be a lot of spit. There's gonna be blood occasionally. Um, we don't necessarily deal with things like the calculus and the tartar like the hygienists do, but that is another thing that forms around the teeth and can kind of break off while we're doing a procedure if there's a lot of buildup around there. But mainly for us is the blood and the spit. What I'm using while my dentist is cleaning out a tooth, cleaning decay out, that's another thing. If the tooth is really decayed or we're removing an old filling, say, you've got pieces of silver filling or the white filling, the tooth colored filling flying around at times. So I have suction. So I have what one that's called, that I use most of the time, is called an HVE. So it's a high volume evacuator. And then I'm also, that's in one hand, and then the other hand I'm always have my air and water syringe. So I'm collecting whatever he is cleaning out of the particular tooth or area that we're working in, and I'm also drying off the tooth or his mirror so he can see clearly. So I'm constantly in there cleaning up. So it's my little mini vacuum. I have another smaller one too that people, if they need a break in between or they need to spit into, I have a smaller one called saliva ejector. So
Wow, that's a
those
great.
are my tools always in my hand.
Mhm.
But I'm always prepared when the doctor needs an actual instrument. I've always got 2 in my hand as well. So again, it's always thinking ahead of your dentist. So I know over these years, I know what my dentist is going to need. I'm anticipating that. So there's always something in my hand, but most of the time during the active procedure of him cleaning out a tooth are my little mini vacuum and my air and water.
Great. That's really helpful.
Yeah.
So, okay, walk us through any kind of specific training you needed. I know you needed a lot of training.
Yes.
And also just how you got into the profession briefly.
So the short version of how I got into it, I knew that I wanted to do something to help people. I originally was looking at being a dental hygienist. At the time, I was getting to the end of my years in college. I was at a JC. So I was in my 3rd year when I really made this final decision. And the dental hygiene programs at the time were very crowded and a lot of waiting lists. Well, I was ready to get out there into the workforce and get going. I still wanted to be a dental hygienist, but I found out about a dental assisting program. So I had already taken several science classes, prerequisites, that kind of thing that would apply to getting my Associate of Science degree, and also would later on apply if I decided to go on to be a dental hygienist. For dental assisting program itself through a JC, I think the only prerequisites that I really had to have were like an English class, math class. There may have been one more, but just to apply to the dental assisting program, those were the basics. So the dental assisting program that I went to was through a community college. There are also ROP programs out there as well, but I chose the community college route, one, because I was already finishing college. I wanted my associate's degree. That's what I'd already been working towards. And the program I was in set you up to take your state board to be a registered dental assistant. So you cannot be a registered dental assistant and do the procedures that you're able to do without that special licensing. So that program set me up to take that at the end of the time. So it was a 10-month program that I initially went through. During that time, I was in school 5 days a week. And at the end of the program, you went into an actual dental office and you would intern for total of 300 hours. That was the requirement. And so you got a lot of hands-on training and work. You could choose to go into a general office or a specialty. So I actually split my time up. I interned in a general office and for an orthodontist to really see where I wanted to be. So I graduated at the end of that program. I had my certificate of completion from the program, and then I earned my Associate of Science degree. And then a few months later, back up a second. I also in the program earned my x-ray license, because you have to have that to be a registered dental assistant, because we do take x-rays all the time. And what's called a coronal polishing license, which most people are familiar with that with your dental hygienist. At the end of your cleaning, you have your teeth polished. So as a registered dental assistant, you're able to do that as well. So I had to have those 2 things before I could even apply to take my state board test. So then I graduated in June. In August, I took my state board. So there's 2 parts to it. You have a hands-on practical and then a written test as well. And once you pass those, then the state says you're allowed to do all of these certain procedures according to the California Dental Association or Dental Board, and you're off.
Right. You mentioned ROP as an option. What is that?
Yes. Regional Occupational Program. So they may be different things in different counties, but most of them have something along those lines, of vocational training program. And you can also start your dental assisting career that way as well.
Mm-hmm.
It's a lot more of independent work as far as getting your dental assisting license, but it can be done. But usually those programs also will set you up with an internship, so you can get a lot of hands-on and make sure that you really want to do this before you commit more time and effort into it.
Wonderful. Yeah, it's nice to know there are different ways of getting into a career field.
Absolutely. And my other training, so to get the extended functions license, so I did not go on to be a dental hygienist. I really enjoyed assisting, stayed with that. And I graduated from the program initially in 2003. So then in 2016, I decided to go back and get the extended functions license, which was also a 10-month program, but it was weekends. But I went through that training and went through more, another hands-on test through the state and a written. So that's where that came in. With that license, I'm able to place a filling in a tooth. I still am not able to remove anything from a tooth. So we kind of are saying in for extended functions assistance is the doctor drills it and we fill it. So
An extra specialty. Yeah.
yes, yes.
Well,
So,
that's great info. Thank you.
yeah, sure.
All right, we're going to get into what you like best and of
Yes.
course, what you like least. So thinking of just a really general student audience who will be
Yes.
seeing this, you know, what is your favorite part of this job and what is your least favorite?
Yes. So my favorite part is definitely any sort of transformation. So in general dentistry, that can be something as simple as changing a silver filling to a composite filling. The idea of cleaning out the bacteria from a tooth, putting it back together and making it healthy and aesthetically pleasing. That's a simple thing in general, you know, and what I loved about orthodontics was watching the transformation in someone's smile. A lot of people would walk in covering their mouth. They didn't want to talk, with showing their teeth. And by the end of treatment, they're walking out and they're confident, but that applies in general too. So people come in not feeling so great about how they look. It could be something very simple as, like I said, the one filling, and you just see a change in people. So that's really exciting to be able to see that. The thing that's the least favorite is when people don't necessarily take their oral health seriously, because it's important. People tend to think that their mouth is completely separate from the rest of their body, but we're all connected. Our head is connected to the rest of our body, and it's a serious thing. There's bacteria in there, and it can cause problems to your overall health, and it's a serious thing. And it's sad when people don't take it as seriously as they need to. So that's kind of hard because you can only do so much when someone's in your chair.
Right. Yeah.
So,
Yeah, that
yeah.
can be hard to deal with.
Yeah.
So for those students who might be interested in this career field, what's some general advice to get them started and also to know if this is right for them?
To get started, I would say the best thing is if you have a dentist already, whether, you know, a general dentist, an orthodontist, any of the above, and most of them are very open to this because we're all most of us are very passionate about this field. So if you're interested and all you have to do is ask, they will let you come in and shadow for a day or a couple hours or whatever it may be. But yeah, check out, there's so many different dental specialties that people are kind of unaware of. And there's different things that you get to do and see. And to me, it's all really, really interesting and cool stuff. So just ask. That's all you have to do. Ask your dentist, or ask, if you don't have one, ask a friend. Hey, do you have a dentist, and do you really like them? And can I get their phone number? And just ask. And more than likely it'll be an assistant showing you around the office and showing you what they do all day long. And to know if this is really something for you, that's a tough one, because I don't want to turn anyone off to it. But yeah, you know, you have to know that you're not going to be easily grossed out by things. And you want to know that you can talk to people all day long, because a lot of my job is just talking and listening to people. When it comes down to it, you know, there's been times that we have older patients come in and that's kind of their only outing. So they may come in for a toothache or something else, you know, really simple, but really they just want to have interaction with people and talk to us. And so that's a huge part of my day. So you want to know that you can talk to people and you want to help people. So, and not everyone wants to do that, and that's okay. In this field, yeah, helping and talking and listening, I think is the best thing.
This has been so helpful. Thank you so much.
Good.
I think it's important for students to realize there are specialties, and every field has a specialty. So starting with someone who's expert in that, like a dentist, easily accessible, and seeing where you might fit in, like pediatric versus something like what you do in general practice. So thank you so much for your time. Really
You're so welcome. Good luck, everyone.
Thank you.